Started then. Welcome everyone who has joined us for tonight's webinar. My name is Melinda St. Louis, and I am the Director of Public Citizens Medicare for All campaign. And I want to thank you all for joining us tonight for this very exciting webinar for our Medicare for All Resolutions Coalition that brings together a broad array of really powerful partners that are fighting for Medicare for All. Obviously, we are having this webinar in the midst of a heated primary season, and many Medicare for All activists have been deeply engaged in that primary process, and they're going to continue to be in states with upcoming primaries around the country. On tonight's webinar, we won't be focusing on that electoral process or the candidates. There are plenty of other fora for that discussion, but instead we're going to focus on how we can continue to build on the growing public support for Medicare for All. We, in all of the primary states so far, we have seen I'm sorry, I'm having some technical problem here. Hello, can folks hear me? I think I had a technical problem for a second, sorry. In all of the primary states so far, exit polling data has showed that a majority of Democratic voters have supported replacing our private insurance system with a government-run system that covers everyone, or Medicare for All. So majority of Medicare for All support has been everywhere. Some states higher than 70% of voters, and every single state it has been a majority of folks have said they've supported Medicare for All. So we need to capitalize on that momentum. We know that regardless of who wins the nomination or the presidency or any single congressional seat, we will need to build a massive grassroots movement that will be able to counter the corporate backlash that we are seeing in order for us to actually win Medicare for All. So tonight we're going to talk about launching a concerted primary push, post-primary push, for Medicare for All resolutions in states that have just finished their primaries and that we will be rolling out in states as they finish their primary process. Our Medicare for All Resolutions Coalition has built a really impressive grassroots base so far. We have over 300 local efforts underway to pass city and county council resolutions around the country. And thanks to many of you who are with us here tonight. And these local resolutions are part of a broader strategy to build our movement from the ground up, to educate the public and to urge our members of Congress to support Medicare for All legislation. City and county council officials are well positioned to make the local public health and economic case for a more humane, sane, and efficient healthcare system through Medicare for All. And we hope that through these webinars and our toolkit that we have on the website at medicareforallresolutions.org and other support that we provide, you can help lead these efforts in your community. So tonight we have a really exciting lineup of speakers who are leaders nationally and in their communities as we launch this post-primary push for resolutions. We're going to hear from Representative Rashida Tlaib, a powerful voice in Congress for Medicare for All and many progressive causes. Dr. Abdul El-Sayed, the former director of Detroit's health department and a Michigan gubernatorial candidate. Larry Cohen, the board chair of Our Revolution and former president of Communication Workers of America. And we'll also hear from Mayor Trevor Elkins from a small town in Ohio that recently passed a resolution in support of Medicare for All, and activists in Ohio, Florida, Louisiana, and Maryland to update us on the organizing efforts in their communities. You can feel free to ask questions in the chat box if you are logged on your computer, and if our panelists will try to answer them as we go along, or you can email us any questions at bshanahan, SHANNAHAN at citizen.org, and we will try to get back to you. So let's jump in. So first, I'm thrilled to welcome Congresswoman Rashida Tlaib, who represents Michigan's 13th Congressional District, which includes West Detroit. She's the first Palestinian-American woman who's a member of Congress, and along with Ilhan Omar, is one of the first Muslim women to be in Congress. And she has taken Washington by storm as a champion of progressive causes, including Medicare for All. Her home city of Detroit was also one of the first cities that passed a Medicare for All resolution this year. So really, we're really honored to have you with us, Congresswoman Tlaib.
No, thank you all so much for inviting me into your space. I really appreciate it, and it's always good to be with my brother in service, Dr. El-Sayed, in this movement, getting us closer to universal health care. As many of you know, much of the work that we've been able to do, all of us, in transformative change, maybe, our parents, generations before us, on really transformative, radical transformative change has primarily been because of work on the streets, the grassroots work, and really getting fellow Americans, our neighbors, involved in this movement work and understanding their voice actually matters, and getting this to become a reality. One of the things that, as we move forward in organizing around this, is intersectionality, right? We talk about this all the time, but Medicare for All, as you all know, is racial justice, it's economic justice, is so interconnected with so many other social justice causes. So we need to try to do more around how do we connect to other movements, movement folks and movement works, and working together on this, because I know, having the third poorest congressional district in the country, that if we had Medicare for All right now, so many of my folks be uplifted more out of poverty, would not be facing bankruptcy, would not just yet see, increases in their premiums, deductibles, lack of access to insulin and other drugs that people need to survive. And so all of that, again, is so interconnected to all the work that we've been doing. I know in my district, and Dr. El-Sayed knows this, I mean, we're frontline communities that has some of the most polluted zip codes in the state of Michigan. So when we had a congressional hearing in my district around environmental justice issues, one of the people that spoke up was a woman from Flint who said, we're already sick now because we did nothing about climate. We're already sick because we did nothing about poverty, right? Because all of that is, again, how she explained how it's so connected. But now you're asking us, after you got us sick, after you put profits before us in Flint, Michigan, you are now asking us to figure out how to get access to health care and to even the mental health that so many people have gone through, some of the trauma there. And she said, also, not only do we need, the Green New Deal, but you know what, we also need Medicare for All. And so, a lot of folks are kind of doing this now and with the coronavirus and saying, well, see, look at all this, and now you got to figure out how to get people get access to health care. It's just a great example, though, of what happened in Flint and how that's interconnected to the need for universal health care and Medicare for, in transition, Medicare for All. So as you work on this, remember the words of Grace Lee Boggs, Detroit activist, who said, transformative change doesn't happen in the halls of Congress, but it happens on the streets with all of us. Anything that has been radical, which to me is exactly where we need to be. It's radical love, as my sister Ilhan Omar would say. But it's the change that people want to see. It's this it's the sense of urgency right now, because right now there's a lack of urgency, right? We can wait. Well, we can't wait because when we wait, people die. So Grace Lee Boggs always reminded me as a young activist that, the anti-war movement, the women's rights movement, the civil rights movement, the labor rights movement, all of that didn't happen because somebody introduced a bill in Congress. It happened because all of us organized outside of the halls of Congress. And it eventually pushed them to where we needed to be. So I hope people know how critical that is. And I love that local council folks are very much passing resolutions and uplifting the importance of this for our country. And I hope people understand that is just the beginning of how you really get movement on the ground in various neighborhoods. But again, thank you so much for having me in your space and for continuing this effort to organize.
Thank you so much, Congresswoman Tlaib, and we're so grateful for your leadership in Congress and all that you're doing to build that intersectionality and to connect all these issues together. It's absolutely critical, and we're so and we are going to try to build the movement that we need, right, to be able to achieve many of these things. So thank you again, and thank you for your time. We know how busy you are, so thank you so much. Next, I want to invite Dr. Abdul El-Sayed, who is another Michigan Medicare for All powerhouse. Dr. El-Sayed is a physician and also served as the executive director of the Detroit Health Department and a health officer for the city of Detroit from 2015 and 2017. He was also a Michigan gubernatorial candidate and a really strong political activist in the state and around the country. He's also been a public health professor in addition to a physician. I was at the Department of Epidemiology at Columbia University. He knows from all angles why we need to build the movement for Medicare for All. So Abdul.
Thank you so much. First of all, I just want to say it's a privilege to have a 1-2 punch for Medicare for All from Michigan, and really, really grateful for all the work that you all are doing at Public Citizen and all of the elected officials across this country to get it done. I just want to share a perspective from Detroit. I was the health commissioner in a city where 50% of the population was Medicaid eligible and got their health care through Medicaid. But that doesn't include the full donut hole of people who don't have private health insurance through an employer and are not Medicaid eligible. And we know that those folks suffer because of it. And then there's all kinds of people who even have private health insurance, largely through employers, who still can't afford to get sick because their deductibles are so high. Average deductible is now pushing $5,000. If the median family income is $50,000, you think about that's 10% of your annual income that you might have to pay just to get access to the healthcare that you already paid for in your premium. And that's just a broken system. The consequences are clear. We know that people who don't have access to healthcare are sicker because of it. And in a recent article in The Lancet, which is an extremely well-respected medical journal, estimates suggested that about 68,000 lives a year is what we'd save in America if we pass Medicare for All. And to put that in perspective, they also looked at whether or not, or how many lives would be lost if we repealed the ACA, and that was about 35,000 lives. To put it in perspective, there are twofold more lives that we have yet to be able to save if we pass Medicare for All, above and beyond what the ACA already saved. And I told you, I come from a city where 50% of our population is on Medicaid. And that was largely made possible because of the ACA. So we've got a long way to go. And of course, what's on all of our minds right now is coronavirus. What we don't appreciate is how much sicker we all are because we don't have universal access to healthcare. A lot of people every year go without care for the nondescript symptoms of, you guessed it, a fever and a cough. Which is exactly what coronavirus looks like. This season, it's plausible that people will have the coronavirus and actively choose not to seek healthcare because they're worried about being hit by that deductible. And what that means is that they may be inadvertently passing it on because of it. Our system makes them sicker. It makes us more susceptible to that illness. And it's a ticking time bomb. Above and beyond that, we don't have a system that incentivizes pharmaceutical companies to actually invest in the care for diseases like this, where there's not a big payout on the back end. They'd rather be making Viagra than in a vaccine for a potentially deadly viral epidemic. And under Medicare for All, we can change those incentives. And then lastly, it's just the morally right thing to do. We're the only high income country in the world that does not offer universal access to healthcare to its folks. Medicare for All would do that. The view from Michigan is that I can see Canada across the river, and what I see is a place where they live 2 years longer on average than we do. They pay nearly 50% as much, 60% as much as we do, and they're happier for it. We could do that if we're willing to have the political courage to stand up and get that done. And so we have that responsibility to keep working. I am so honored to be with you guys tonight because you've been leading that fight. And we know that that fight's going to happen from the ground up. And it's going to be elected officials and organizers and local community members pushing that drive to make it happen at the ground up, building that groundswell that's going to build to Medicare for All for our country, for our future. So really grateful for you, grateful for your work, honored to be here, and look forward to partnering in the future.
Thank you so much, Dr. El-Sayed. You know, we will be talking a bit later on the call about the post-primary push for Medicare for All resolutions as states complete their primaries. And we know that Michigan's primary is next Tuesday. We're planning a Michigan-wide planning call shortly thereafter to identify and move city efforts across the state so that Michigan cities and towns can join Detroit, which the Detroit City Council that passed a Medicare for All resolution. We're nailing down an exact date and time of that with Congresswoman Debbie Dingell and other state leaders. But if you're from Michigan or know people from Michigan, let us know, and we'll be sending info for that call soon to move it forward in Michigan and elsewhere. And again, we thank you so much for your leadership and for your clarity on this issue, and thank you so much. I'm now thrilled to turn this over to another national leader and incredibly important partner in our Medicare for All Resolutions Coalition, Larry Cohen, who is the board chair for our revolution. Larry was also formerly the head of the Communication Workers of America. He's a powerful leader on many progressive issues, including Medicare for All, and so we'd love to hear your perspective, Larry.
Yeah, thanks, and great to be here with everyone. I saw the names of many of my friends and our revolution leaders flashing across the screen. Great to join with all of you in this effort. So let me just say first that, yes, for 10 years until a couple of years ago, I was the president of the CWA. Every single large negotiation was focused on holding on to the healthcare like we're on the side of a cliff that people had fought for in previous generations. And so when I hear presidential candidates, which we won't name, talk about how union members love their health insurance, they clearly don't love their health insurance. Union members love their health care. They like their health care providers. They don't like the fact that premiums go up, even in the best of union contracts. The costs go up. They're out of control. If somebody loses their job for one reason or another, they then don't have that care. So we all know those reasons. I'm just saying that for me, this is quite personal. It's one of the reasons I said to 50,000 shop stewards, I'm not going to run again for president. I'm going back to the streets, feeling incredibly boxed in on this and other issues that, couldn't be solved through collective bargaining. So let me switch to our revolution and what we're doing. Most of our focus is on the Jayapal bill. We are working closely with Member Jayapal on Bill 1384, not so much the content, but to get more members of Congress on that bill. The good news is, as most on this call would know, we have 120 co-sponsors. That's a little more than half of the caucus members. The other news is that all across the country, including my hometown, which I'm going to come back to in a minute, Philadelphia, we have Democrats in communities where there's massive support, majority support for Medicare for All, who are not co-sponsors of the bill. So in our revolution, we do, as lots of groups do, constant surveying. What is your most important issue? And 2/3 of our members, repeatedly when we do these surveys, list Medicare for All as the #1 issue they want us to work on. And that's a remarkable number. This is not the number that support, that's virtually 100%. This is the number that of all the issues, climate crisis, racial justice, immigration reform, free college, on and on and on. 62% say this is our #1 issue. So earlier last year, we had what we call the ambulance tour, where we had an Our Revolution ambulance running around 2 communities all over the Midwest, South, and East to generate events and get support, people signing a Medicare for All pledge. And those folks still remain the basis of lots of our support. We recently had a town hall call with Member Jayapal, with over 7,000 members, our revolution members on that call. This is one of our regular membership calls. And again, gigantic enthusiasm to work on this issue. I want to focus on, because there's only a few minutes, what we're doing in Philadelphia that actually is pre-primary and will go on to post-primary. Again, it's not around a presidential candidate, but it is around what we call I'm a Medicare for All voter. This is a program that the Debs Douglas Jones Institute just concluded in South Carolina, where notwithstanding the results of the primary there, they found that an overwhelming majority of voters, black, brown, and white, supported Medicare for all, have built a basis for that, and that will continue on. In this case, in Philadelphia, we have a situation where Representative Brendan Boyle is on the bill. The other three members in Philadelphia and its suburbs are not on the bill, which is Evans, Dean, and Scanlon. And so next Friday night, we're doing an event in Philadelphia at the community college, not so much education as to train volunteers on how we're going to move those three members, as well as pass resolutions, which folks on this call are leading in support in communities large and small in the Philadelphia area. But the focus is going to be on the 31,000 Now Revolution supporters in those three districts who overwhelmingly support Medicare for all, but yet we have three members, despite consistent efforts, not just from Our Revolution, but many groups, have yet to sign on the bill. And Representative Jayapal will be with us at that meeting, kicking that off along with Representative Boyle. And in a very kind way, we will be sounding the alarm here for the volunteers that we need to call, which is what we'll be doing. We'll be calling the 31,000 Our Revolution members, and other groups will be doing something similar, getting them on the pledge, the Medicare for All pledge, and getting them to commit to show up at an event. First of all, to deliver thousands of petition signatures. Our goal will be at least 1,000, and we hope to go far more than that in each of those three districts. And to say to those members of Congress, it's time to get off the fence. It's time to get out of the middle of the road. Your voters support this overwhelmingly. And we'll be leading, so in that event next Friday night, 45 minutes of it will be training from Catherine Isaacs, Debs Jones Douglas Institute, but all in the economics. So lots of the volunteers will be union members. And what we found is to move union members, we need to lead off not only with the moral issues, all the bad stories, et cetera, but the economic issues, that basically every family will save, even if there is some kind of payroll tax that's shared by employers and employees, every family will save far more than $5,000 a year. And the candidates running for president that turn this around and talk about $20 trillion know that what they're saying is false. So we feel like what I call the elevator pitch, that we can give an elevator ride pitch in literally a couple of minutes about the economics of Medicare for all. That again, virtually everybody on this call would already know, but that we can close the gap between the healthcare broken system that we have now, among the most expensive in the world, that we can close that gap very easily by the savings from getting out from under private insurance, from cutting the cost of pharmaceuticals, and a payroll tax on employers that for employers would be less than half of what they're paying now. This is small and large employers are paying over 20% of payroll. So a payroll tax of around 10% would close most of that gap, as long as we also had probably a small payroll tax on employees of a couple of percent. So we feel quite strongly that based on the work we've done, that if we lead with the economic issues and we confront basically the lies of the supposed extra cost, when in fact, Medicare for those who want it is what creates extra cost, because there's no basis to pay for it, and you're stapling that on top of the existing system. We're quite energized by this and believe that we can have success in Philadelphia and in its suburbs, and that our members and leaders there are quite excited and again, happy and looking forward to working with allies to show that we can move this number from 120 co-sponsors on the Jayapal bill towards 150 and then 200. And in fact, that's the way we're going to pass this. We're going to pass it in the House, and we're going to pass it by convincing and pushing members of Congress to get on this bill.
Thank you, Larry. And Philadelphia, the Eastern Pennsylvania has really been on fire in terms of the organizing around Medicare for All and the resolutions, which is really exciting. You know, we've seen Philadelphia and some of the suburbs, and even Bethlehem, Pennsylvania, Easton recently. So very exciting and really important to be focusing on, especially those members of Congress who have campaigned on Medicare for All but have not yet signed on. So thank you to our revolution and to your leadership as well. So now I'd like to turn it over to a really important state partner in our Medicare for All resolutions effort to talk about an important recent victory and efforts to build the base in the purple state of Ohio. Debbie Silverstein is the director of Single Payer Action Network Ohio, who will share with us a recent victory from the town of Newburgh Heights, Ohio, and can introduce Mayor Trevor Elkins, the local official who led that effort. So Debbie.
Well, thank you for having me on tonight. And we're pleased that we had that victory. And so we want to thank Trevor for his efforts on that, first of all. SPAN Ohio is a statewide organization. We work for single payer healthcare at the national level and at the state level. And we have representatives out around the state, and we're working on this issue all over the state of Ohio. We passed a resolution in Lucas County earlier in the year or last year, and we are working on getting resolutions passed in Cincinnati, in Dayton, in Cleveland, in Kent, and down in the Columbus area as well. And so it's a concerted effort all over the state to do this and that. Now, Trevor Elkins and Newburgh Heights were a very easy sell because, and I wasn't kidding, we met in a bar in Lakewood, Ohio. And actually we were at a fundraiser for Mike Skindle, who is the primary sponsor of the Ohio single payer bill. And I met Trevor, and Trevor said, send me some language, we'll get it passed. And so I did. I sent him some language and he got it passed. So I'd like to turn it over to Trevor to talk about how he got his council to pass that. And some of the, he's done some remarkable things there. They're going to a 32-hour work week for the city employees. So Trevor, you're up.
Well, thank you very much, Debbie, and I appreciate the opportunity to be on tonight's call. So as Debbie mentioned, we did kind of hatch the idea at a fundraiser in a bar in Lakewood, Ohio. My community is a small community immediately adjacent to the city of Cleveland. And we do, fortunately, we've been able to take that and turn it kind of into a microphone because we do get picked up by a lot of media for some of the stuff that we've done. So much of what's happening in America around progressive issues is happening at the local level because of many of the challenges that occur in the state capitals and Washington. Just some of the quick things that we've done, as Debbie mentioned, we instituted a 32-hour work week, full-time work week for all of our employees, student loan forgiveness program, and 6 months paid leave. But this really came about, it's always something that I've believed in. And what we were able to do, the way that I was able to sell it is really quite ironic. I presented the language that Debbie had provided to our council, but roughly at the same time, we had just renegotiated a medical insurance policy for our city employees that saw about 11% premium rate hike in a single year. Our employees pay about 15%. It's a good government plan as far as plans go, but our employees pay about 15% of that premium. And then, so what happened at the same time, I am on that plan as a full-time mayor. I'm considered a full-time employee. I get the same plan that my employees get. Roughly at the same time, one of my twin daughters is going through some emotional issues. So we had her in some counseling. So despite having a $2,250 premium for my own policy that comes out before I even go see a doctor, then we have a $4,000 deductible in addition to all the copays. So all while all this is happening and Debbie's providing me the information, I get an invoice from our local hospital in the amount of about $1,600. And I'm fortunate enough that my wife and I are both gainfully employed and we're doing better than a lot of folks in our neighborhood. we were able to, cover that expense, but we could not imagine, I could not imagine what it would be like if I was working for, $14 or $15 an hour, just struggling to get by with a couple children. So I was able to take that invoice to a council meeting and share it with my colleagues and say, look, we're all of us sitting on this dais and this podium making these decisions are fortunate. Most people are struggling paycheck to paycheck in America today. We have the chance to use our bully pulpit to share with the greater public that there is a better way to do this. So by and large, we did have one member of our council that is a union steward. They made the comment, well, I like my union insurance. And after some conversation, what we really determined is they were afraid that they were going to go backward and that they didn't want, quote unquote, the government taking over their medical coverage. So once we were able to share with them that they still get to go to their doctor, they still get their medical coverage from the provider they like, it's just a matter of who's paying the invoicing, the bill, that conversation went away. So I used a very personal experience for myself to sell this. And I think that's very impactful when you're standing in front of your local council or legislator about how you can really change lives and improve the quality of life for your constituents. I'll turn it back over to Debbie and
Yes, thank you so much, Mayor Elkins. We really appreciate your leadership and your perspective. We hope that local officials from around the country follow your lead. And really, your story is unfortunately extraordinarily common, right? I mean, you talk to basically anyone, and everyone either has a story or knows someone close to them who has who's gotten a surprise bill when they go to the doctor, even though they thought they were in network, or who can't afford their deductibles. And those are the reasons why we do this work and why we have to do it. So thank you so much for your leadership. So we will soon hear from 3 more national and local key partners. But before we hand it over to them, Brittany Shanahan, our key organizer with Public Citizen and who's speaking with activists all around the country all the time as the key organizer with the Resolutions Campaign, will share more about the launch of this post-primary push for local resolutions in states that have already completed their primaries that I mentioned. So I will turn it over to Brittany for a minute.
Great. Hi, everybody. So here's the idea of this sort of, post-primary push. So the idea is that again, like no matter who ultimately wins the nomination or the presidency, we have to build a massive grassroots base in order to win Medicare for All. We know that Medicare for All motivated voters to the polls in the primaries, and so we want to capitalize on that momentum. We have hundreds of local efforts underway to pass Medicare for All resolutions, but we want to do a concerted push after the primaries to move many of those efforts over the finish line. Please sign up to join our post-primary push in your state at the link that we are pasting into the chat box now, or sorry, it might be chat box, depending on how your window is now. And you'll get a follow-up email about it as well. So, I mean, if you are new to this, we can connect you with other activists in your area and provide you with all the tools and support you'll need to win a Medicare for All resolution in your town, and you'll be my new best friend, which is enough, surely. We've also put together some state-specific social media resources that look super cool and can be used in your state's post-primary push for Medicare for All. Whether you've been working on a resolution for months or whether you'd like to just get started, you can sign up to be part of the post-primary push in your community for Medicare for All resolutions. As I mentioned earlier, in some states, we will be hosting specific state organizing calls after the primaries are over. And again, like if you've been in it for a little while, this is also for you. We're gonna try and learn from some of the lessons and the difficult circumstances we've had recently and push those push those resolutions forward. We're starting with Super Tuesday states, California and Colorado. Now that the primary is over in those states, we're ready to dig in. If you or anyone you know are in Colorado, we'll host a Colorado post-primary push call on next Tuesday, March 10th. So March 10th at 7 p.m. Mountain Time. And we'll circulate the info for that call to folks in Colorado. For California, we will host an organizing call for Southern California. We're still getting the date on that, but it'll be pretty soon. Whether your state's primary has passed or will be happening later, just sign up on the link that Melinda just gave you all to let us know, to be in touch with you as part of your state's post-primary push for Medicare for All resolutions. Now, if you are on the phone, if you're on the phone and you've got this on speakerphone while you're doing the dishes and feeding your kids, walking the dog, so that we don't know what you're doing, so you're on the phone, we don't see you. Also for you, you can't click on that link, but when we send out, we'll be sending out an email with the video to this resolution in a few days, and we'll have the link there. So just check if you aren't able to see the link because you're not on Zoom. You can expect an email from us, or you can just email me or call me. Yeah, so that's my pitch for today.
Great, thank you so much, Brittany. I'm now really glad to invite Silvia Fabela, who's from our important coalition partner, Local Progress. This is part of the Center for Popular Democracy, a key partner in the coalition that is working for Medicare for All across the board, and especially with resolutions. Local Progress is a network of progressive local officials. It's already quite a number of Local Progress members have helped to champion Medicare for All resolutions, from Philadelphia to Detroit to Durham, North Carolina, and beyond. So welcome, Silvia. I think you are on the phone. You should.
Thank you so much. Thank you for queuing up who Local Progress is. I would just add that, Local Progress is a movement of local elected officials, and we're focused on advancing a racial and economic justice agenda through all levels of local government. And what's really exciting about Local Progress is that the elected leaders, they're building power with underrepresented communities. They're sharing bold ideas and policy amongst our network, and we're fighting to reshape what's possible both in our localities. We're working to build power at the state level, and we're also working to help to shape the national narrative. We believe that by working together, our members are able to win change across all local government and at the state and federal level. I think following everyone else is a tough act, but as you've heard from others, coronavirus is really challenging us to change our system to meet the needs of all of our communities. And so what I would say here is that last year we worked with Local Progress members who are some of the most progressive and really rising leaders in the country, people who are invested both in Medicare for All and in advancing all of the policies that everyone here on the phone believes in. I will also note that Congresswoman Tlaib is also a Local Progress alumni, so we see our folks rising through the ranks. And so I'll just note that in Philadelphia, it was there were council members like at-large council member Helen Gim in Philadelphia, or Mayor Pro Tem in Durham, Jillian Johnson, who were working to pass these resolutions because they know and understand that that local governments are often providing frontline response for people who fall into poverty due to medical debt-related bankruptcies, or who are experiencing deteriorating health due to lack of adequate health insurance. And so I can reassure you that the local elected officials in both the Local Progress Network and in all of your communities, I can assure you that they really want to work with you, and would encourage all of you to set up a meeting with your council members. Local Progress, and we're happy to share this out with share this out with everybody, but we have a set of template resolutions that we really tweaked to apply to local government to really address why this is critical for them to pass and the perspective for them to share. So we're happy to share all of those materials. And I would just, again, really emphasize that the role of local leaders here. They represent communities, and by ensuring that we're passing more resolutions across the country, we believe that having a conversation about Medicare for All can help between local governments, can help to advance the national agenda. So I'm happy to share those materials. I'll turn it back over to you.
Yeah, yes, thank you so much, Silvia, and thanks to Local Progress members and to the staff. It's absolutely critical resource, and so folks should, as we are doing our post-primary push, we can reach out to many of these progressive local officials as part of that process, and to really team up to push this agenda forward, so that we can show the massive grassroots and grass tops and municipal support for this important policy. So thanks so much to Local Progress, and we're so grateful and want to continue to collaborate with you. Next, I'm really excited to invite Tiffany Burks, who is an organizer with Indivisible, which is another really important coalition partner in this effort. Tiffany organizes in Florida and Louisiana, and I believe Mississippi as well. And so we're really excited to hear from Tiffany.
Hello.
Hi.
Thank you for the warm welcome, and you did get it right. I do organize in Florida, Mississippi, and Louisiana, and Indivisible Project is an organization that was founded shortly after Trump was elected, and pretty much the organization came out with a guide to help folks be able to feel prepared to not only fight anti-Trump regime, but also to realize all the different structures that were in place that kind of created his presidency in the first place. And so essentially, when it even comes down to talking about like a local campaign such as this, is really giving people the tools and the skills to feel like they are prepared to take this local initiative and pass it on a municipal / local level. And so that's why I'm very happy to be partnering and doing this work with you all, with my different groups, and even inviting the organization to come to our New South Institute, because a lot of times I think folks just need the tools and the resources to say that we're not, creating something new, that this is actually solutions that have been passed on local levels already, and giving folks making them feel empowered that they can also do it on the local level, by sharing the packet, inviting your organization to come speak to local leaders to show people that there is a pathway to make this initiative pass, and then this can create the good energy needed for like a national resolution to be passed as well. So I think just by, I felt like empowered when I heard you speak at a local meeting. And so I'm like, I want as many groups to, actually hear this message, because I think that that's what makes people feel like they are actually that they can actually see a win when they see that other resolutions have been passed and whatnot. So I feel like my role as an organizer is to give people that motivation, especially on a local level, that they could actually get this passed. And I feel very inspired to do this work and continue to build up the good energy with different group leaders to get this passed. And I'm at an event where there's drums in the background, so if you're getting that good energy in the background, that's that. So yeah, so just very excited to be doing this work and doing the partnerships, because I definitely do believe that having the coalition and working with people is what really gets to the win. And I think that that's really what Indivisible is about, is really partnering with other organizations to really push a lot of our efforts forward, and having people realize too that engaging in the electoral stuff is super important, but issue-based organizing is also very essential to our work. And it doesn't matter who's in office, and if we could build a strong team of people together to feel still very empowered no matter which way an election swings, that we could still move people and move elected officials by hearing stories and sharing those stories, sharing our own personal testimonies, is what also too is a part of the work of keeping people engaged even past the primaries, past an election, is also to say our work continues by pushing these issues forward. So just very happy to be doing this work and collaborating.
Thank you so much, Tiffany. We had a great group, and I've talked with a great group of Indivisible chapter in Palm Beach, Florida, and we also know that there's a great effort underway to push for a resolution in New Orleans, Louisiana, and elsewhere in Florida. And so we're really excited to be partnering with all of the organizations like PDA that has been leading in many of these areas, DSA, PNHP, but also Indivisible. So thank you so much, and we look forward to continuing that work. And then last but not least of our local activists, I really thrilled to welcome back Chrissy Holt, who's a fierce activist in Maryland with the Maryland Progressive Healthcare Coalition. They've been really working doggedly throughout Maryland, targeting members of Congress, but also their cities and counties to raise awareness for Medicare for All. So I want to turn it over to Chrissy.
Great, thank you so much, and thanks for the invitation to talk tonight. So, you know, Medicare for All is a very personal issue for me. 25 years ago, my son was born uninsurable with severe hemophilia A, and I have been fighting for his health care for over 2 decades. So this story isn't new, and it feels great to be with, you know, brothers and sisters who are in this fight with me. And so I was asked to talk tonight about what we're doing here locally in Maryland and around our state. The Maryland Progressive Healthcare Coalition is about a year old now. It's built with unions and doctors and nurses and progressive groups across the state of Maryland. As we were sort of coming together, to meet, we were, oops, I just lost contact. Can you all still hear me? Can you still hear me, Melinda? Okay. So there's different counties across the state of Maryland, and we're all sort of managing it, you know, based on our different local councils and things. So here in Anne Arundel County, we came out of the gate pretty strong, following up with the Medicare for All resolutions, because part of Steny Hoyer, who of course is the Speaker in the House, owns part of his district is in Anne Arundel County. And to what Larry was saying earlier, when we have the majority of the Democratic caucus, so we have our representatives that are voting for Medicare for All, we know the majority of the Americans want Medicare for All. So it makes sense that the leader of the House would then allow this to come to a vote, and we would be able to move forward. So we're bringing the pressure to him through the grassroots efforts and meeting with our county officials and with our city officials. But specifically here in Anne Arundel County, we worked on the local campaigns for our county executive, Stuart Pittman, and he definitely supports single payer. But when we started meeting with our county council members, they were all thinking that healthcare is not a local issue, and they weren't going to bring up the resolution. So since last September, we have gone every month and we testify before their county council for 2 minutes on why healthcare is a local issue and how it affects the local people here in Anne Arundel County. So we've brought, you know, stories about businesses closing. We had a friend who was denied his cancer medication. I mean, just stories, you know, because we know that healthcare is so personal and it affects us, all of us here on a local issue. And it was just shocking that somebody on our county council would say that. So for months now, since September, and I would invite all of you, if you're still pushing as hard as we are, that at least in our county council and also at the Annapolis City Council, the microphone is open. If you don't have a bill that's on the floor, you can grab the mic and give your testimony. So we're constantly recruiting people. We usually have, you know, 3 to 4 people that grab the mic, not only in Anne Arundel County Council, but we recently did it at Annapolis City. And that moment, because a friend of ours was denied his cancer medication, and he was a friend, he said, you know, I will help you with this resolution. But you know, we have to really push these local people to understand, you know, the breadth of the resolution, that we understand that we're not asking for financing. We're not asking for the mechanics. We're asking for their support to send the message up to Congress to have our congressional folks sign the bill. So we have had action, and also Baltimore City is really the next live action events that are going to be coming up. There's going to be a hearing in Baltimore City. They won't they won't work with us on the resolution, but they are willing to have a hearing to sort of push the narrative. There will be a press conference on March 18th at 4:30. There's also going to be the hearing itself. We have 7 speakers, and that will be March 18th at 5 p.m. So that's the next action here in the state of Maryland. But before that, we've also held 4 Medicare for All town halls around the state in each of the districts where our congressional members have not signed on. And we're just going to continue to push. I mean, Maryland, while they say we're done, we're a blue state, we really don't, we're really not progressive. And, we come up against, we try to get progressive leaders in office, but we don't have enough of them in place for us to actually get the progressive policies in place that we want. I mean, an example of that is, Maryland will say, oh, great, we passed a $15 an hour minimum wage, but that goes into effect 5 years from now, right? So it's shenanigans like that, up and down the ballot in the city and the county council. So thank you for letting me join tonight, and I hope you guys will take the opportunity to grab that microphone, testify whenever you can, share your story, and we'll just keep pushing the narrative. And hopefully the next time we come back on, we'll have a win from someplace in the state of Maryland. So we're working on it. Thank you.
Thank you. It's been really inspiring to see all of the efforts throughout Maryland, and I think what you said is really critical, because a big piece of why we're doing these local resolutions efforts, we know that those resolutions aren't going to change policy overnight. But what it's about is trying to educate people and to get earned media and to tell those stories and to have another opportunity locally to do that. Because what we know is that the insurance industry and the pharmaceutical industry, they are spending millions of dollars as part of the Partnership for America's Healthcare Future. They're buying millions of dollars in ads. In Iowa, half of all the political ads that were bought were attacking Medicare for All. There is an enormous effort to confuse the public, to scare the public about what Medicare for All means. And so what we need to do is make clear that we need to tell our stories about what's happening in our current system and what's broken in our current system, and to tell the truth about what Medicare for All is. And Dr. Bill from PDA has been writing in the chat something I think is really important, that for municipalities, it's a local issue because it is obviously the health of our populations locally is critically important, but it also means enormous savings for municipalities if we were to have a Medicare for All in a way that we could actually invest in infrastructure and in social services that municipalities aren't able to because of the rising costs of health insurance just for municipal employees. And we're finding that as you dig into those numbers, council members are seeing, wow, this is something that we really should be looking at from an economic perspective, as well as from obviously the moral and public health perspective. So thank you to all of the activists in Maryland and elsewhere and throughout the South. And what we're hearing here is that there is a diverse and vibrant movement, and it's not just in blue states, it's not just in purple states, but in red states as well. And that when we go local, we actually have an opportunity to cross some of these partisan lines to be able to, because everybody needs healthcare, and everybody actually, when you ask the question, and there have been questions about public opinion, we actually are seeing, despite these enormous investments from the pharmaceutical and insurance industries to attack Medicare for All, there's still majority support, even though people are scared. So I think this grassroots effort is a way for us to build that. So we have covered a lot of ground tonight, and I want to make sure we finish before the hour. And I've been inspired by all of our panelists. I hope you all have as well. I think our movement is very strong with the expertise and the doggedness and the commitment that everybody in in this coalition have, I know that we are going to win guaranteed health care for all, for everyone living in the United States. It's not going to happen overnight, but we are building that movement. And that's why we hope that you'll join our post-primary push to move the more than 300 efforts we have underway over the finish line in the coming weeks. We recognize that people need to focus on the election. Absolutely support that. But once the primary is over, we can really catapult that momentum into the grassroots support that we're going to need and to build that. So if you please do sign up at the link for our post-primary push, whether you've been working on this for months or you want to get started in your community, we want to be pulling people together and to launch this forward. So again, I've put it in the chat a bunch of times, the link to sign up for the post-primary push. And we do have many tools on the Medicare for All resolutions.org website. Brittany and our coalition partners locally and nationally, those who spoke and many more who are also part of this effort are here to help. So please also let us know if you want to give an update or at an upcoming webinar. These monthly webinars are for our whole community to be inspired and to learn together. And so you can mark your calendar now for April 1st, Wednesday, April 1st at the same time. And do look for the calls that are going to be organized potentially in your state. As we mentioned, Colorado and California and Michigan, we expect to be first as we roll out after the primaries to really dig in and to build on the momentum that we have. So again, and I want to thank everybody who joined us, all the attendees. We know that you are doing incredible work in your communities, and we look forward to hearing from those as well. So thank you. Have a good evening.